everybody. Hey guys, hey guys, hey guys, hey guys. Welcome back to our YouTube channel. My name is Lasara Motapa and I'm currently a 5th year medical student at WITS, and I'm on a journey to becoming Dr. Motapo. Now I'm back with yet another reflection video. We will be reflecting on the rotations that I've done, and we talk about how I found them, if I love them, if I don't, what I loved, what we were doing, and what the rotation is all about. And then you guys will let me know if it's something that you guys love, something that you guys would want to see yourself doing in the future, or what. Yeah, I've done like a big rotation and then like smaller rotations. So a big rotation is ideally 6 weeks long, and then smaller rotations are 2 weeks long. So now today's rotation that I'll be talking about is ENT, which stands for ear, nose, and throat. So that rotation is a small rotation. We do it for only 2 weeks, and that's what I did earlier this year. I just forgot the date, but like earlier this year. And what ENT is basically about is like, it's like a speciality that focuses solely on the ears, the nose, and the throat. So any sort of thing. So from the ears, things like people have like ruptured tympanic membranes or like eardrums. People have like a lot of ear wax in there that's stuck. People have like foreign bodies in their ears. If they have like hearing problems and they need like hearing aids and stuff, all in there. Nose, we think looking at things like your sinusitis. People have maybe like foreign bodies and they don't care, sometimes they put like stuff in there. So sinusitis, we're looking at sinusitis, we're looking at tonsils and like any sort of like abscesses that can develop there. And then we're also looking at things that have to do with like your speech, so like things like your larynx and all of those. We look at them, larynx, vocal cords, to look if maybe there are any cancers there that can arise. So you get like cancers that are in the larynx, you get cancers that are like in the tongue, right? So it's called ear, nose, and throat, but essentially we look at like the face, like this part of the body. That's what the head and neck is what we focus on. So the ears, the nose, the mouth, but not the teeth, and the throat. So with the throat, people have like throat cancer. People have like I don't know what you call it, like I don't want to use like big medical terms, but like people have throat cancer, people, let's say kids who like swallow stuff and now it's stuck in there, they have to take it out. So that's basically it. I think for me, one of the interesting things, first of all, ENT for me was interesting. It was very interesting. All these like small specialities, are all these small things that I never really like thought about much or put much thought into them. Right, so like I saw a couple of patients who had like an issue with like they like their breathing pipes or whatever, like, and they couldn't breathe through them. So maybe they had like throat cancer or something like that. And the interventions that they do is that they can put what is called a tracheostomy. So basically they make a hole over there and they put like a breathing pipe right there, and the patient breathes through that, because like the breathing pipe just is not working or like something like that. So they make an incision. It's like a small incision, like an incision there, and then they put that like breathing pipe there, and then they breathe there. And then also, if they when they want to speak, they also so they have to like close it off and then speak through it. So you can't speak unless you've like closed it off, it was just so interesting. Like I never knew about that at all. Like that whole thing for me was just so interesting. So they always have to clean it, and also you have to go for like speech therapy and stuff, like once they put in that thing, because you don't speak like how you normally would, because now things are a bit different. So you have to go for therapy to train you how to like close there and speak there. I think for me, what stood out was this 14-year-old boy who came to clinic, and he had recently, like I think a week ago or so, gotten his tracheostomy. So that boy came to like clinic and stuff, and then because his thing was still new, you have to cut out like the sutures and stuff, like the stitches, you have to cut them and stuff. And he was so terrified. Like it was still very fresh, like a week or so. And then I had to help the doctor sort of keep him still, and then sort of low-key take out that breathing pipe and then cut on the sides where they've made like the suturing and stuff, just so that it can heal properly. And that guy was terrified. Like he was literally shaking. And I mean, it was a very quick procedure and everything, but it made me think, this boy is 14 and he's got a breathing like pipe and stuff. and he's not like his peers anymore. So I literally just thought so much about that boy and how potentially like he might be bullied and has like, because the thing is, he's not intellectually impaired. The only impairment is that he cannot speak like he normally like other normal people do or whatever. He has to use a breathing tube. He has to use that to breathe and then occluded to speak and stuff. So for me, it made me think of the interventions that are like medicine has, like the different interventions that are available to us with medicine, and how they can help patients. But then also there's also the thought where you think about in communities, like in our communities, how was that received? You know, like I don't know, that was my first time like ever seeing a patient with that, and I didn't know of it like ever. So I'm like, are there people in our communities who have those? Do you know of anybody who's got like a tracheostomy or it's a stomy? Anyway, look up the proper word. Like, who do you know of anybody in your community or like family or whatever who has that? And how has that been for you guys? How was the experience? And like, what was your understanding of it initially? Anyway, there was that. So we learned how to insert that. Like we were like helping one of the doctors like insert it and stuff, like on another patient, and then how they should clean it, training them to speak and stuff. We saw a lot of people with like salivary gland tumors. We saw people like we saw a lot of, for me, ENT was very interesting. Like it's all these things, man, that I really wouldn't think, oh my goodness, guys, like sinusitis is, your sinuses are like a big thing. Like never downplay people who say they have sinuses, because a lot can go wrong from like complicated sinusitis. Like there was this young boy we saw in theater, not in theater, in the ward. Shame, he had complicated sinusitis, and like the complications are so like horrible. Oh my goodness, like his complications are like really bad. Like one of the complications that you can have, like the eye sort of bulges and stuff, and then like it almost comes out, like he swells all over the eye and then almost like comes out, and then it was like red and bloody and stuff. Oh, shame, that poor boy. He ended up losing like vision in that eye. So it was like very interesting to see all those things that I've never really thought about. Like they operate on like small parts. They can operate on like a carotid body over there. They can operate on like your sinuses there at the back. They operate on tonsils and stuff. Oh my goodness, I actually just remembered. So the one day we had clinic, and then at clinic, so what I loved also about ENT is that like with clinic we got to like interact with patients and stuff, and like they'd give us like our own patients, and then we see them and then report to the doctors. So the one time my group members and I were interviewing like a parent, because the child had come for a tonsillectomy, so they're removing their tonsils, and then so we're interviewing the parents, whatever, whatever. And then turns out that this child had recently had like a tonsillitis, like flare up and stuff, and this child has like problems with their sleeping and whatever. But then like I feel like the last time they were there, they didn't tell the doctors, because the child was brought in by her grandmother the last time. So it wasn't like written and stuff that this child has those problems. So we found out those stuff from talking to like the parents and like proper asking, because that day the dad came, like proper asking like what's going on, what's happening with this child, etc. So turns out that this child had these problems. And I see the thing is, if the child has these problems, you cannot operate. Like you cannot, it is dangerous to operate. You just don't, because the child will need an ICU bed afterwards, and like so many other considerations before you just go for like a tonsillectomy. So we like, I went to a doctor and I was like, okay doctor, so I just presented, because I didn't know like what was going on. Like, well, we all presented, because we're just like, oh, okay, that's what we found out. And the doctor was like, wait, this child had a tonsillitis recently. We're like, yeah, like even right now. They're like, oh my goodness. And they're having sleep apnea. We're like, yeah. And they're like, oh my god, no, we cannot operate on this child. And like we're like, what? They're like, oh my gosh, thank you guys so much for finding this out and doing this. So we felt like we had just saved the baby, because the doctors were like, oh my gosh guys, this was a huge save, because they wouldn't have planned for like, you know, something like that, because it wasn't in like, it wasn't given as part of the history when they asked like the parents what's going on and stuff. But anyway, we felt like heroes. We felt like we had really like helped out and stuff. It was so beautiful. They explained to the dad why they can't do the surgery anymore, like at that moment in time. And it was just so grateful that like they didn't go ahead with it, or that we managed to find out those like extra bits of info, because essentially when you spend time just talking to the patients and just asking extra information, like just spend time and talk to them, you actually find out so much. And I think that's also another reason why I love clinic. Like we really spend time and talk to patients, and You get to know them, you get to know like what they're there for, what's going on, and everything like that. So I really love that. And then in terms of theater, we didn't really go to theater. Well, we went once to watch a tonsillectomy. The thing about it is that because of COVID and stuff, there are like a lot of regulations, so we can't always go to theater, and like they're working on like very small parts and stuff. So it's like, yeah, we didn't really get a lot of theater time. We had a logbook. Did we have a logbook? Yes, we had a logbook. We had to see a certain number of patients, do a certain number of things, do examinations and stuff, which is really nice. Like, guys, the doctors in ENT, shame, guys. Yo, like, they are those people that look like they've had 10 hours of sleep, very happy, very nice, calm, no rush in the world. Like, literally, those, like, people in ENT are the true definition of soft life. They are literally good quality of life. And yeah, like, if you are thinking of ENT or a specialty that isn't as heavy or as like demanding as all these other ones, from what I've observed, ENT is the one. Like, the one time in our ward, we're doing a ward round, and in the ward round, there were literally only like 4 patients in the ward, like 4 admitted patients, and that was it. Like, that was the ward round. I was like, damn, like, it's done. And then another thing that I loved in ENT, when we had like grand ward round, this is when like the consultants and them would come, would have to like dress up in formal wear and stuff, and I really love that. Like, I love dressing up, so I really love that we got to dress up in formal wear. Like, on Tuesdays we had like our grand ward rounds, and then you had to like dress up and stuff, and then yeah, so that was ENT for me. Did I like it? Yeah, it was very interesting. I did. Would I consider it as a specialty that I might want to do? Possibly, but if I did ENT, it would literally be because of the quality of life that the doctors there seem to have. Not necessarily because it's something that I'm very passionate about, or really like, you know, it's no, I'm not passionate about it. I find it interesting, but I'm not passionate about it. And I would love like that quality of life that the doctors they have. Like, yeah, no. So I would definitely do it for that. Part of my top 5, no. Top 10, maybe top 10. And yeah, did you guys know about ENT before this? Is there anything else you'd like to know about ENT? And yeah, guys, let me know if you maybe thought of becoming an ENT surgeon, or you've heard about it, or maybe you've had a tonsillectomy or whatever, and you had like experience with the ENT before. Let me know in the comment section below. And yeah, so guys, as always, I gotta love and leave y'all. Let's keep the love going, let's keep the channel growing, and I'll see you guys next time.